So when you're starting a plan of care, whether that's chiropractic, physical therapy, whether it's whatever else, anything that you're looking at to improve your health, when are you actually done with that program? I'm Dr. Jeff Cumro, and over the past 15 years, I've been blessed to work with over 5,000 people, helping them optimize their brain function, their body function, and then supply the energy to those areas so no matter what environment they're in, they get the outcome that they want. So I think it's important to dive into when are you done with your program of care? And all of this comes down to it depends on what your goals are, right? So when we look at things, we have two ways of looking at this. And the first way of looking at this is the insurance perspective, right? And insurance is going to look at things a little differently than, well, pretty much anybody else looks at it, right? Because they're a business, they're working to make money, right? And with that, they've got a preset deal, so we have a decent idea of when that's going to be. Now, are there always surprises? Anything can happen in that, right? So it's one of those things where surprises do come about. But when we look at it, what they're actually trying to do is get somebody from the state that they're currently in to the state that they were at before, or the state that they're as good as they're going to get. So instead of getting you to a point of health, they're going to get you to a point of not being sick. And that may sound like the same thing, right? Because we've been trained that if we don't have any symptoms, we're healthy. And that is not always the case, right? Because we have people that don't have, a sickness or an illness or anything like that, but they've got diabetes. They're still not healthy, right? We've got to have all functionality in all areas to actually express health. And that's a big elucidation of it. It's something very, very important for you to understand. Because when we look at health in general, what the chiropractic paradigm ultimately tries to do, and that's the next thing we're going to dive into, is optimize function, right? And when we can do that, obviously we're healthy. But when we don't have symptoms anymore, it does not necessarily mean we're healthy. It just doesn't mean we're hurt. And another way of looking at this is if you've got a threshold value, and right here is where you get out of symptoms. What insurance is trying to do is take you from down here where you're in symptoms every single day, and they're trying to bring you up to this line right here. And as soon as you're over that line, that's where they say, you're good. You're done. You don't have symptoms anymore. We're not going to cover it. So it's kind of like if you get into a car accident and you take your car in, they are going to fix the damage that was done to the car in the accident. But they're not going to fix all the other rust spots. They're not going to pay for oil changes. They're not going to fill you up with gas or anything like that. They're going to cover the things that get your car back to functional. But they're not going to cover the things that make your car good, right? It's the big difference between these. Now, when we look at an actual overall, like what is the goal for everybody else involved in it, whether we're talking about the practitioner, whether we're talking about the patient or anything like that, we ultimately want to see optimal health, right? We want to see optimal function. And that doesn't stop when we're just out of symptoms. Because I see people every single day, they come in and they're, every 6 months this flares up. I went out and I worked in the garden and it's back. I went out and, I lifted one of the kids and it's back. Doing different things. It should not be there in a consistent manner, right? We want to get to a point where we're not in symptoms all the time. We want to get out of symptoms, but we ultimately want to optimize health. And when we get that optimal health, you can go and do those things. Doesn't mean you're not ever going to get hurt. No, obviously there's going to be things that happen from time to time, but we can greatly minimize those. And really, if something like that does happen, you're going to move in the right direction so much faster. So, ultimately what all this comes down to is, when is care over? It depends on what your goal is. If you're looking to get healthy, what research shows is that chiropractic care continues to get healthier and healthier as you go on. If you consistently use chiropractic care, those patients that do continue to get healthier and healthier as they move through. So if you've been under care for 1 month, you're not as healthy as somebody who's been under it for 6 months, who's not healthy as somebody who's been under it for a year, who's likely not as healthy as somebody who's been under it for 2 years. Now, there are a lot of factors that go into that as well. What's your diet? What's your sleep? What's your stress level? All those other things have to be considered in that, obviously. But when we break it down, the research shows that health in those that have been under longer-term regular care have better outcomes. When we're looking for an insurance perspective, once we get you back to that non-broken state, I guess, for lack of better terms, that when the symptoms get turned off, that's when you're done. So it depends on what your goals are. And this is something, like I said, I think it's important to dive into because, again, very, very frequently I get asked, Doc, am I done? Hey, can I come in once a month? And ultimately, it depends on what your goals are. I will always support everybody's goals, but at the same time, when we work to get healthier, that is the ultimate goal. Because health right now leads to health in the future. If we don't build health right now, if we're just getting to that point where we don't have symptoms, sooner or later we're going to have a big hiccup in the future. And one big hiccup in the future can lead to 10 big hiccups in the future. We see those people that don't have anything wrong with them, and then they hit a certain age and they have a bad year and their health just starts to unravel. And that's obviously what we don't want. So sit down and look at your goals. What do you want to accomplish with your health? How can we help you get there? If you have questions on this, reach out to me. I am happy to talk in more specifics for your specific case. But reach out. Let's answer whatever questions you have, and let's go from there. But as always, I do appreciate your time. I do appreciate your attention. I know those are your greatest resources, and I appreciate you spending some of that with me. I will catch you on next week's video, and I hope you have a phenomenal week in the meantime.